Ayurveda Explorer. Subscribe my channel and press the bell icon for latest update.
The humanity has been afflicted by yet another devastating calamity. The novel coronavirus emerged in Wuhan city of Hubei province, China, at the end of 2019. The World Health Organization (WHO) has declared it as a worldwide pandemic. Multiples of strategies are being evoked to limit the spread and relieve the infected. In this context, Department of Ayurveda and Alternative Medicine, in collaboration with Nepal Ayurvedic Medical Council and Ayurveda Campus and Teaching Hospital, have come up with the guidelines of preventive measures and management protocol for COVID-19 in Nepal. Ayurveda experts' recommendations based on Ayurvedic literature and scientific publications for preventive health, curative management, and boosting Oja, with special reference to respiratory health in Ayurveda, have clearly set a remarkable imprint in course of stabilizing and managing the pandemic. Ayurveda does not focus on microbiological etiology, but rather embraces holistic approaches for elaborating details of disease. Here, the newly detected diseases are dealt on the basis of its dosha involvement and signs and symptoms expressed, thereby approaching the management. Here, the epidemics are discussed under the term of Janapada Dvamsha, where it is mentioned that due to either of deranged Vayu, Jala, Desha or Kala, outbreak of certain diseases take place, causing deaths of large population in a single episode. The diseases are generally classified into three classes: Adi Daivika Bala Pravrita Vyadhi, those that cannot be controlled by human intelligence; Samsargas Upasargas, transmitted directly from infected person to healthy person; Upasargika Roga, communicable and contagious diseases. An unknown disease like COVID-19 can be elaborated with three different approaches: Vikara Prakriti, natural history of disease; Adhisthana, site of pathological process; and Samuthana Vishesha, etiological features. Considering the epidemic outburst, the natural history of the disease clearly falls under Rakshasadi Prakopajanya Janapadodhamsha Vikara. It can be grouped under the class of Agantuja Vyadhi with special reference to the class of Bhut Vishangaja. Microbiological etiology. The current data shows 40% cases were very mild with no symptoms of viral pneumonia. 40% of the cases were having moderate symptoms with mild pneumonia. 15% were having very severe symptoms and 5% were critical. Generally, 98% of patients have Jwara, 70% have Tandra, 59% with Batik Kasha, 40% with Aruchi, 35% having Angamarda, 31% having Shwasa, and 27% were having Kafas Kasha. Considering all these signs and symptoms, it can be contemplated as Kapha Bata Samsarga Jwara, of course with the Pitta association in the beginning, but it acquires the status of full Sanipata Jwara in certain subset of patients as the condition progresses. Due to the compromised Rogi Bala, the coexisting Pitta, even mild, is causing Shandana and Soshana in the chest progressively, which cannot be resisted by the body. The process can be technically described as Dhatupakam, a dysregulated host response from the context of Sanipata Jwara. This results in the rapid instability of ojas, leading to sepsis and eventually septic shock. Because of Shandana and Soshana property of intervening Pitta, the Jwara may end up in the fatal forms of Sanipata Jwara, of which two special fevers are worth mentioning: Vata predominant Sanipata Jwara, titled as Bisfarak Sanipatas, and Vata Kapha predominant Sanipata Jwara, titled as Shikhrakari Sanipata Jwara. Along with the change in the nature of Jwara and Swasa, which was previously a feature, later it becomes prominent as a Upadrava. Adhisthana, site. The proper Adhisthana of COVID-19 can be suspected as Kosta itself, but the manifestation happens in Uraha, which itself is a predominant site of Kapha. Many a time it has been found that Pitta dosha exerts a significant pathological influence on Kapha. The Ushna guna of Pitta in combination with the Saisneya and Drava guna will exert a pathological effect on Kapha, thereby making it asthira and abadda. Here also, as stated in the description of the stages, Pitta can trigger this pathological cascade leading to Shyandana and further Shoshana. This can lead to Dhatupaka and death. Samuthana Vishesham, the etiology. The occurrence of Kapha Vata predominant Sanipata Jwara as a Janapada Dhvamsha and the influence of Ritu as in Bashanta Ritu points to the rapid and violent vitiation of Vayu, Udakam, Desha and Kala due to the activities that can be earmarked as Pragya Paradam. Moreover, the predisposing factors such as the old age and comorbidities are reasons of deteriorated Rogi Bala and which results in instability of ojas and fatality. The proposed clinical stages of the disease: Kapha Vata Sanipata Jwara, aggravation of the already existing situation, the stage of initiation of Dhatupaka due to unchecked activity of Pitta dosha, Dhatupaka proceeds and Swas coming forward as Upadrava, Sanipata Jwara, title as Visfarak or manifests and becomes fatal, which needs technological support along with Atyatik Chikitsa, emergency treatment. The protocol is classified under two sections, Section A with preventive measures and Section B with curative management protocol. Section A involves three different categories including preventive measures for apparently healthy individuals, individuals staying at quarantine, and self-isolation or isolation ward. Preventive measures include information driving through the vastness of Dinacharya, Ritucharya and Achara Rasayana to maintain healthy life by increasing the immunity and help cope up the deadly disease. Category 1. Preventive measure for apparently healthy individuals. Steps 1. Standard alcohol-based sanitizer or home remedy sanitizer. Take neem leaves, tulsi leaves, Greta Kumari, Titepati and dry garlic in equal portion by weight. Boil the mixture with 4 times of water and reduce to 1/4 of it. Filter the decoction and mix 1 gram of fitkiri powder in each 100 ml of decoction. It can be used as sanitizer, body cleansing, floor cleanser or natural disinfectant. 2. Daily practice of yogasana such as Surya Namaskara, Gomukhasana, Ustrasana, Bhujangasana, Setu Bandhanasana, Padmasana for 10 minutes. Pranayama, Anulom Bilom, Kapalbhati, Bastrika, Brahmari for 10 minutes. Loosening exercise like spinal twisting exercise, joint mobilization exercise for 10 minutes. Meditation with Omkar chanting, meditative or relaxing music therapy for 15 minutes in the morning. After completion of Yogasana, 80 to 100 ml of Guruji decoction or tea is recommended in empty stomach. 3. Intake of 2 to 3 liters of lukewarm drinking water throughout the day. 4. Take Chavan Prasam in the morning or fresh amla or amla churna routinely. Diabetic patient should take sugar-free Chavan Prasam. 5. Spices like besar, jeera, marich, dhania, dalchini, timur and lasun should be used for cooking routinely. 6. Nashya, nasal application. Apply Anu Taila or sesame oil or cow's ghee 1 to 2 drops in both the nostrils in morning and evening. 7. Gandusham, well pulling therapy. Take 1 tablespoonful of sesame oil or mustard oil in mouth and swish it for 2 to 3 minutes. Speed it off followed by warm water rinse. This can be done once or twice a day. 8. Drink herbal tea or decoction made from tulsi, dalchini, maricha, sunti and kali kismis or as per availability of drugs. Add jaggery, fresh lemon juice as per your taste if needed and take once or twice daily. 9. Dhupana. Mix gugulu, nimpatra, vacha, kutha, harro, sarso, lavana, lasun or pyaj, yava, titepati and grita and burn on flame of fire. 10. Yogic cleansing therapy under guidance of expert and heliotherapy should be done for 30 minutes in between 7 to 10 am. Category 2. Individual staying at quarantine. 1. Follow first, second and third step of category 1. 2. Follow 6th and 7th step of category 1. 3. Take Chyavanprasha. Diabetic patients should take sugar-free Chyavanprasha. 4. Intake of golden milk. Half teaspoonful of Beshara powder and half teaspoon of Jaggery as per own taste in 150 ml of hot milk once or twice daily. 5. Singadarva Vaidya Khana Tulsi tea or Guruchi tea or prepare and drink herbal tea or decoction made from tulsi, dalchini, maricha, shunthi and kalo kismisa of equal proportion and prepare in desired amount and take once or twice daily. Jaggery, fresh lemon juice can be added as per your taste if needed. Category 3. Self-isolation or isolation ward. 1. Steam inhalation with fresh mint and tulsi leaves and Beshara powder can be practiced once or twice in a day for 5 to 10 minutes. 2. Gargle 4 to 6 times with salt mixed hot water. 3. Mix lavanga powder with honey or misri and intake 2 to 3 times a day in case of cough or throat irritation. 4. Gargle with drugs mentioned earlier. 5. Follow first, third and fourth step of category 1. 6. Follow fourth and fifth step of category 2. 7. Chitraka Haritaki. Take twice daily with lukewarm water or lukewarm milk. 8. Yashtimadu Churna. 9. Mahasudarshana Churna or Kwatha in case of fever. Section B. Curative Management Protocol. Patients with positive case of COVID-19 having no symptoms following treatment for 7 days. Trikatu Churna, Sudarshana Churna, Samsamni Bati or Gilo Yagna Bati. For Rasayan Chikitsa, Ashwagandha Churna or capsule, Brahmi Bati or Churna, Chyavanprasha. Kapha Bata and Sannipata Jwara. Patients with positive case of COVID-19 having mild symptoms, mild fever, mild cough, no breathlessness. Management of Ama Jora Chikitsa in primary stage with Langana by any one from the following drugs when symptoms persist from 5 to 7 days. Sundhi Jala, Shadanga Paniya, Chitrakadi Bati. Following treatment for 7 to 15 days. Trikatu Churna, Sudarshana Churna, Tali Sadi or Sitopaladi Churna, Samsamni Bati or Gilo Yagna Bati. For Rasayan Chikitsa for 15 to 30 days. Ashwagandha Churna or capsule, Chyavanprasha. Kaphabhata Sannipata Jwara. Patients with positive case of coronavirus, including all symptoms of corona, together with allopathy treatment but not in ventilator. Management guideline: Jora Shamana, Kapha Shamana, Bata Anulomana, and protection of Rogi Bala in 5 different steps of treatment. Management of Dosha Pachana: Trikatu Churna, Sudarshana Churna, Samsamni Bati or Gilo Yagna Bati. After 7 days of symptoms, it turns to Madhya Jora and following can be taken as its management. Talishadi for dry cough or Sitopaladi Churna for productive cough. Samsamni Bati, Lakshmi Bilasa Rasa. Additional drug: Mriga Madashava, Guduchi Kwatha, Esti Madhu Kwatha. Pakwa stage: aggravation of already existing situation. COVID-19 positive with specific symptoms at moderate level. Management guideline: Jora Shamana, Kapha Shamana, Bata Anulomana, protection of Rogi Bala, particularly important in geriatric and those with comorbidities. Kapha Nisharak management can be needed for 5 to 7 days. Talishadi for dry cough or Sitopaladi Churna for productive cough. Chitraka Haritaki, Lavangadi Bati, Amrita Rishta. Additional drugs: Kankashava, Trivan Kriti, Satyadi Kwatha, Kirata Tikta or Mahasudarshana Kwatha. रसायन चिकित्सा, अश्वगंधा चूर्ण और कैप्सूल, ब्रह्मी बटी और चूर्ण, च्यवनप्राश. Dhatu Paka and Swas coming forward as Upadrava. Complications due to unchecked activity of Pitta dosha. COVID-19 positive with severe symptoms with respiratory distress etc. and progressive towards fatality. Management guideline: Jora Shamana, medicines to stop Dhatu Paka, medications for bronchodilation and expectoration, protection of Rogi Bala in a more potent and aggressive manner. Special procedure enlisted in Sanipata Jora Prakaran needs to be applied. Kankashava, Trivan Kriti Rasha, Satyadi Kwatha, Kirata Tikta or Mahasudarshana Kwatha. Rashayan Chikitsa based on kapha in Uraisthana or according to the age for 15 to 30 days. Ashwagandha capsule or churna, Brahmi Bati or churna, च्यवनप्राश. Dhatu Paka process and Swasa coming forward as an Upadrava. Management guideline: the same as above but in a more potent and aggressive manner. Special procedure enlisted in Sanipata Jora. Sanipata Jora, title as Bisparakam or manifest and becomes fatal, needs technological support along with Atyatik Chikitsa, emergency treatment. Apparently healthy individuals for immunity improving drugs. Following drugs can be prescribed for 7 to 15 days. Dasmula or Pathyadi Kwatha, Samsamni Bati or Giloyagna Bati, Ashwagandha Churna or capsule. Post-recovery maintenance to prevent recurrence and health restoration. As per Ayurveda concept, there is Dhatu Chaya and Agnimandya Avastha after Jora Mukti. Although the test report may be negative, but if symptoms of shortness of breath are present, then it may be state of Jirna Jora and Ausad like Guruji, Pipali should be used before Dhatu Poshana. Dhatu Poshana Rashayana Sevana with drugs like Draksha and Basha for at least 30 days and to combat the residual effect of the virus on the body. Bisagna Chikitsa with Bedanga or Haridra Churna are suggested after clinical recovery. Cardioprotective, hepatoprotective and renal protective drugs like Arjuna Churna, Amalaki Churna, Boya Amalaki, Punarnava Kwatha, etc. may be given for 30 to 45 days after clinical recovery to combat the toxicity produced from antiviral drug therapy. Dipana and Pachana drugs like Sadangapaniya, Mustan, Shundi may be used in the case of diarrhea, vomiting or loss of appetite. Dhatu Poshana and Rashayana may be provided for a time period of 30 to 45 days as per the discretion of physician. Ashwagandha Churna or capsule, Brahmi Bati or Churna, च्यवनप्राशम, Amritarishta, Draksharishta, Basha Avaleha or Kantakarya Avaleha, Amalaki Churna or Trifala Churna, Kalameka Churna, Vidanga Churna.
Ayurveda Explorer. Subscribe my channel and press the bell icon for latest update.